I'm a clinical psychologist focusing on doing psychotherapy, meeting with clients one on one, some groups, but mostly individual psychotherapy.
What is psychotherapy? Is it sitting down and talking with someone and fixing them?
Well, psychotherapy takes a variety of forms, but what's most common is kind of what you describe, other than the fixing them. So, most psychotherapy involves sitting down, having a conversation between a client and a therapist. And it's not so much about fixing the person, but going through a process using psychological principles, having a theoretically oriented, structured set of conversations with the aim to help the client work through issues, concerns, problems, and come up with some new thoughts, new feelings, new behaviors, improve their life.
This form of talk therapy
Yeah.
um, seems to be popular. People seem to be talking about, especially where I came from in LA, seeing their therapist. Would you be called a therapist?
I call myself a therapist. Yeah. Counselor is a synonym. When I meet people for the first time, I explain counseling, therapy, psychotherapy. They're all synonymous. I'll use the term therapy. I consider myself a therapist for sure.
Does it work?
Depending on what sort of measures or outcome measures you look at, from a scientific perspective, so far as research goes, um, it can show quantitatively measurable improvement when we look at groups of people. It doesn't work for every individual, but when we look at groups of people, comparing those who do therapy and those who don't, as a group, those who do therapy measurably have improved outcomes, better lives.
When you talk about this sort of therapy, you mentioned principles, you mentioned outcomes, you mentioned how people would come in and have a change when it's done. How do you determine these goals and outcomes?
Well, the goals are mostly, if not all the time, set by or driven by the client's agenda. The therapy relationship usually includes discussion of goals and agreement upon goals. Different types of therapy make those goals more or less explicit. But your question is how do you know whether goals are being met? If those are explicit, measurable goals, such as behavioral change, then it's easy to measure. Somebody wants to stop smoking, for example. You can just count how many cigarettes they smoke per day, per week, per month. It's a very easy way to measure behavioral change. So if that's your goal, you put it in those terms, it's easy. If your goal, however, is to simply feel better going through the day, have improved moods, less anxiety, those kind of experiences can be measured quantitatively, but it's a little more difficult because, as I said, the goals of therapy are generally set by or driven by the client. They're often the best measure of outcome and change. And it's very easy to ask questions like, how are you feeling? How's your mood been? What sort of level of anxiety have you been experiencing lately? And, based on subjective report of the client is another way to measure things.
You mentioned smoking as a what? Disease, something to be fixed, something to be changed. I thought psychotherapy was about people who had mental issues or emotional issues. Uh, Cigarettes?
Um, there's different kinds of therapies. Um, Generally, psychotherapy can be useful to facilitate change in any of three areas: thoughts, feelings, and or behaviors. Some people come to a therapist or a counselor specifically with the desire to change behaviors. And smoking is a behavior that some people want assistance in changing. So some psychotherapists will use behavioral principles, psychological principles based on behaviorism to intervene and facilitate behavioral change. Other therapists aren't that interested in behavioral change, more interested in a more subjective thought or feeling experience. And we'll work on facilitating change in that area.
What does your process look like when you engage or take on a client? Do you call them clients or patients?
I call them clients generally, but I've worked in settings where they're called patients. I don't get too hung up about terms like that. I've worked in places where they're called residents. Sometimes they're called consumers. So it doesn't. I don't get hung up on that. Generally, I use the term client.
So, Dr. Fisher, how do you begin this process of therapy with a client? What's the first things you do?
Yeah. If they have arrived for the initial conversation, then I have a little bit of discussion about what therapy looks like in general, what therapy looks like with me that might be somewhat distinctive from what they've experienced with others. As I said, there's a lot of ways of doing therapy. They're sometimes kind of subtle differences, but they make a big difference in what actually goes on in the therapy sessions. I describe the process with me as primarily traditional talk therapy. That is, we're going to sit here and have a conversation, and I'm going to want to know from the client's perspective how they view their concerns, if they view them as problems, confusion, curiosity, distress, anxiety, depression. What is it? How do they describe their own situation? And then
So this is in the beginning. This is when you sit down and talk for the first time.
yeah, the very first time, I'll give them some sort of legal disclaimers about confidentiality, limitations of confidentiality, expectations and risks of therapy. In other words, a process of informed consent. Before I ask them to tell me anything, I want them to know what they might be getting into. And then I do ask them, what kind of outcome do they want? What are they expecting? What are they looking for? How do they see their need or desire for therapy? And then the conversation from there is structured based on theoretical orientations that will guide conversations, question and answer, that will guide what part of the client's report of their life is relevant, notable, problematic, what requires a certain type of follow-up, and interventions from there. It looks on the surface like a conversation. Behind the scenes, the conversation is structured.
And you decided that you decide this requires more visits, obviously. It sounds like it's something that's extended.
I actually always give the option to the client, and I put it in these terms. If we continue on in ongoing therapy, and that will always be your choice, then here's how it goes. Some of that's practical information about how to set appointments. Some of that is here's what to expect in terms of the therapy itself, but it's always up to them. I
So no-
rarely, if ever, say, you know, come weekly for 6 sessions, or you'll be here 12 times, can you commit to that? I don't, nothing like that. It's like, if this is something that you find value in, here's how you access that.
How will they determine that? I mean,
It's a subjective um, experience and evaluation. How will they determine whether they're getting any value out of it? They will be looking at how they're living and how they want to live, and whether or not this process seems to be facilitating a movement in that direction.
so they have to have a goal.
They will have either explicit or implicit goals.
What's the difference? I don't understand explicit and implicit
An
goals.
explicit goal, somebody would come in and say, I want to make a behavioral change. Very explicit. I want to figure out a career path. I'm describing those behavioral changes as pretty explicit, although it's not the type of therapy I do a lot of. The more implicit goals come across in words like, or expressions of, I'd like to fight less with my partner. I'd like to feel better going about the day, or very frequently, I'd like to engage in more social experiences without the burden of an anxiety that makes me either unable to show up or unable to relax and enjoy myself. So those are explicit. And, well, the behavior stuff's explicit. Those are more implicit, as in, you know, I would just like to feel better when I go about my day-to-day life.
And you have found in your years of practice that a change occurs.
For some people, major dramatic changes occur. For others, subtle changes. And for others, maybe not.
So as a psychologist, as a therapist, how do you feel about that? I mean, you decided to become a doctor of psychology. You've been practicing. Is this meeting your goal, your heart's desire for how you looked at it when you started out?
Yeah, more than anticipated. Yeah, this is exactly what I wanted to do.
If you were to talk with someone, because I understand you're a professor and you teach this, so if you wanted to, well, I guess I should say, if you encounter people who either express a desire to do what you're doing, or whom you look at and say, I think that person would find this interesting, engaging, etc., what do you say to them?
I say if it's something that seems interesting, it's something that's available. You know, you can do it. If they want to engage in a conversation that's exploring whether or not it's the quote-unquote right thing for them to do, then we talk about it. When it's not exactly a therapy conversation, but it's an exploration that's similar in terms of what do you imagine this role to be? What do you think you would get out of this? What are you looking for? How do you think this works? What experiences have you had that have provided to you what you think you might get out of this? What worked for that? What didn't work? What are you afraid of?
Is there any particular characteristic that someone needs to have?
Yeah,
talent or what have you?
No, it's not talent. Um, we call it psychological mindedness, which basically means somebody who is curious about inner processes, curious about their own inner process, that is thoughts and feelings, and how that relates to behavior. Somebody who's curious about what goes on in somebody else's inner processes, thoughts, feelings. Somebody who's curious to understand how this all works behind the scenes, that is, behind the psyche scenes. So somebody who is curious and interested in that way, that's the quality that's most important in terms of wanting to go into that and being, it will maintain motivation towards success.
When you started out, did you have these, I want to call them prerequisites, these feelings and tendencies?
Yeah, it's you might call it a personality, a personal style, an interpersonal style, and that we can explore and argue about where that sort of thing comes from. But yeah, definitely, I grew up curious and interested in having conversations with people about how things work and what's meaningful to them.
So does that mean that you don't engage or like to engage in small talk?
I would say that's a fair statement. Part of that is a general kind of social anxiety that a lot of people feel. That is, small talk is sort of, on the surface we are not really getting anywhere, and that it makes a lot of people a little anxious or nervous. If we're engaging in something that's got some depth to it, it's kind of like that's where some people like to swim in the deep end of the pool, let's say. And that's a comfort level there, yeah.
So how do you carry this experience you're engaged in, this psychotherapy, psychological background, when you engage with people in a social environment? I mean, does it become burdensome for you? Are you sitting on a plane or at a party, someone says, "Oh, you're a psychotherapist. Hey, let me tell you my problems."
It's never a burden because I love to do it. There are settings where it's going to be appropriate and we can engage on a little deeper, more personal level. The airplane is not going to be one, but if somebody is curious on an airplane, I'm going to engage with them and satisfy their curiosity about the process more than anything. So rather than engage in that way, I would engage in terms of talking about the process more than anything. But it's something that I love to talk about, so.
If you had to do it all over again,
Yeah.
would you do the same thing?
I would do it about 20 years earlier, but yes.